Albertans continue to struggle because of 6 years of deliberate UCP health care failures. Not only is this government failing to fix health care, they set it up to fail by sucking taxpayers' dollars out of our public system and giving it to their wealthy friends who profit from unwell Albertans. Hence, we have the corrupt care scandal and ministers with MH Care Rolexes. To the Minister of Health, why won't the UCP get back to basics and stop the American-style healthcare experiment?
Hear, hear.
Point of order was noted at 2:39. The Honourable Minister for Hospitals.
Thank you, Mr. Speaker, and I'm pleased to again highlight some of the $28 billion and increasing investments we're making in our world-class public health care system. We just announced a major expansion, over 1,000 net new acute care beds for Calgary and Edmonton. We also announced that we're going to work through our surgical backlog by adding 50,000 surgeries over the next 3 years to make sure that more Albertans are waiting in clinically recommended times for their surgery. So, Mr. Speaker, our commitment to the public system is there. It's getting bigger every year, and it's larger than it ever was under the NDP.
Hear, hear.
Honourable member.
Well, given the Premier is reading from the classic Conservative book of degrading health care to force Albertans in need to pull out their credit cards for expensive private care, and given this government continues to hide its record of health care corruption by failing to be honest with the Auditor General, will the Minister of Health just admit this government doesn't believe in free, public and universal health care?
Yeah.
Point of order was noted at 2:41. The Minister of Hospitals.
Thank you, Mr. Speaker. We believe in public health care so much we've added 1,000 RNs, LPNs, and healthcare aides over the last year. We've added over 600 physicians. We're building more hospital beds. Mr. Speaker, there's a major announcement coming to the Edmonton area for the Stollery, and there's a major expansion of continuing.
Order, people. We don't have to like the answer to hear it, but we do need to let the answer be heard. Please do your part. Go ahead, Minister.
There's a major expansion coming to the Edmonton area for the Stollery that will be announced shortly, and there's also a major expansion coming to continuing care. That's directly in response to feedback from healthcare professionals who said we need more long-term care capacity so that we can move alternate level of care patients out of hospitals to more appropriate care settings so our hospitals function better.
Good job.
Honourable member.
Well, given that there is an inherent right to public health care because of the medicine chest clause in Treaty 6, and given that this UCP government continues to fail their responsibilities and obligations to consult Indigenous people or care for seniors, people with disabilities, vulnerable Albertans, will the Minister of Health tell us explicitly how this government intends on upholding the medicine chest clause with a two-tiered American-style health care system?